No medicine should be taken when it is not giving you a benefit. And when we're on finasteride, we should know that there are periods of time during your baldness timeline when the baldness gene switches off, or in more scientific terms, the gene becomes dormant or goes to sleep. So there is a small test that I'm going to enumerate here. How do you know that the baldness gene has switched off? And that is what we are going to discuss in this video. The baldness gene expresses itself in different ways in different people. There are people in which the baldness gene expresses early in life, early 20s, and there are some in which it occurs later on in life, say in the 40s. Similarly, there are phases in which this baldness gene becomes dormant, goes to sleep, or, as more eloquently put, switches off. So when you are in the remission phase of baldness, that is when the baldness gene is dormant, many people would like to stop the drug finasteride. There is so much of anxiety associated with this single drug, oral finasteride, that people are anxious. They are anxious to know whether the gene has switched off and when they can be off the drug and when they need to resume taking the drug orally. But how do you know that the gene is switched off and you need to stop the drug? After I published my video titled "When Will My Baldness Gene Switch Off?", I received numerous queries wanting to know as to how to ascertain the right time, how to know that the baldness gene has switched off so that you can stop taking oral finasteride. Many people still keep taking the medicine because you can never be sure when the baldness gene is switched off and when it's going to turn on again. So that is also a good thing as long as you're taking the dosage as advised by the doctor. There's nothing wrong in it because everybody doesn't get side effects. Everybody doesn't get breast tenderness, everybody doesn't get testicular pain, everybody doesn't get erectile dysfunction. But there are many others who feel uncomfortable taking oral finasteride. However, you need to be sure that the gene has switched off, that the gene has gone dormant before you stop taking oral finasteride. However, going cold turkey, that is suddenly stopping oral finasteride, can suddenly make you lose all your hair that have been supported by oral finasteride. As we all know, oral finasteride blocks only 73% of DHT. So whether the baldness has stabilized, whether you're taking finasteride or not, hair fall will continue to happen. Every day we lose around 90 to 110 strands, and this hair loss causes us untold anguish. But we don't see that 100 hair that have been lost, 100 hairs are also growing back. But it is natural to get anxious when you see hair falling in the sink. But hair loss is normal because hair fall and grow back in a cycle. There is nothing to worry about. While on finasteride, if you see that your hair loss has slowed down, that is the time that you're ready to take a test, to test if the baldness gene has really switched off or not. Like most of my patients, I'm sure you too take a break from finasteride every 3 months for about 15 to 30 days. If that be the case, extend this period to about 4 weeks or say 6 weeks and see if the hair loss has increased. If it hasn't, extend it to 8 weeks. If there is no appreciable hair loss, even if you extend this break to 8 weeks, that means that the baldness gene in your case is hibernating. So therefore, you should take a longer break. Take a longer break. The longer break could be for about 3 to 5 years. It could be 10 years. So there is no need to take finasteride if you are not having hair loss, because that means that your baldness gene is hibernating. But you have to be ever vigilant, ever cautious. If your hair loss increases, you have to consider reinitiating yourself on oral finasteride. Finasteride is flushed out of the body in 8 weeks, that is 60 days. So if after 2 months you do not see any increase in hair loss, that means that it is not due to finasteride in your tissues. And I highly recommend that if your baldness is stable, if you are not having hair loss after stopping finasteride, you should go off the drug for a long period of time. But always remember that the gene may go to hibernate, may go to sleep. Your baldness may appear to have stabilized, but the gene never really switches off. Therefore, the need to be ever vigilant even after stopping oral finasteride. It is generally seen that between the age group of 35 to 55, this is the period in most people. There are long periods of time when the gene hibernates or goes to sleep. So when we are on long-term finasteride, we need to take advantage of this period of remission, so that you take maximum benefits from oral finasteride without falling prey to its many side effects. So thank you for watching. My aim is to bring you more and more information to keep you better informed so that you are well researched in your hair loss and hair transplant journey. If you like this video, let me know, and if you have any query, do leave a comment below and I'll be happy to respond back. God bless you.